I'm going to present a study, Family History of Neurodegenerative Disorders in Patients with Amyotrophic Lateral Sclerosis, a population-based case control study. We aim to describe the family aggregation of neurodegenerative disorders within a group of patients with ALS and to estimate the risk of ALS development in patients with a positive family history of ALS, frontotemporal dementia, Alzheimer's disease, and Parkinson's disease. A prospective case control study was conducted in a Portuguese reference ALS clinic. Demographic data and information about family history of neurodegenerative disorders from ALS patients and controls was obtained through a standardized questionnaire. Controls were subjects referred to our ALS clinic, but in whom motor neuron disease or other neurodegenerative disorders diagnosis was excluded. A positive family history of ALS and FTD was significantly higher in the ALS group, including in first-degree relatives, as compared with controls. ALS patients did not have an increased prevalence of Alzheimer's or Parkinson's diseases family history, and even after adjusting for age and sex, the risk of developing ALS was significantly higher in patients with a positive family history of ALS or FTD. As a conclusion, a positive family history of ALS or FTD increases the risk of ALS, supporting the definition of an ALS-FTD continuum. The lack of association between family history of Alzheimer's or Parkinson's diseases and ALS suggests distinct etiopathogenetic mechanisms among these disorders. These findings may be considered for proper counseling of patients with a positive family history of neurodegenerative disorders. Thank you for your attention.